What's up, FTS family? In this video, we're going to be covering how to change the status of your patient to being hospitalized and how to move them out of being hospitalized. So what you'll do is you'll log into the portal, and this will be done under your active patients. So let's just say, you have some active patients, you're seeing them, and for some reason they are hospitalized. So what you'll do is you'll go into their profile. So this is Chris Tucker, and the therapist's name is Marky Mark. The assistant right now, there's no assistant tied to them, but I'll let you know what happens if there was an assistant tied to that person as well. So you'll go into View, and down here you'll see Hospitalized. So you'll click Hospitalized, and it says, are you sure you want to update the patient status to hospitalized? You'll say OK. Now, once you click OK, the assistant, if there was an assistant here, will get a notification saying that that patient has been hospitalized. Also, the therapist, the office will also get an email saying that that patient has been hospitalized as well. And so you'll notice this activate or non-admit buttons down here. I'll cover those in just a second. I just want to let you know what happens when you click hospitalized. So when you go to your dashboard, you'll see your hospitalized patients. So you go ahead and click that, and you'll see your hospitalized patients. So Chris Tucker's here, therapist, the assistant's name, and that'll kind of be the bucket that will keep track of all the people who have been hospitalized. Now, for some reason, you want to activate them. What you'll do is you'll click this button right here, you'll click View,
and that'll take you to the patient's profile. What you need to do after that, just scroll down to the bottom. You'll see Activate, and you'll see Non-Admit. Again, if you non-admit, you would click that here. This is where you would activate the patient. So once you do that, you click OK, and then you will get this green text right here just saying that everything was good. An email will go out to the office letting them know that that person has now been activated. And then an email, if there is an assistant here, will go out to them as well. So once you do that, you can go back to your dashboard, and in your dashboard, they will be moved back into new patients. And again, we talked about in other videos what new patients, anybody in this bucket needs to have an eval completed. So you would go in, and here's Chris Tucker, and you would go in and just evaluate them. One thing to notice is that this star right here, this little red star, you'll see this on anybody who's been hospitalized and then they have been activated outside or activated back into the new patient bucket. So anytime you see that, just know that that person was previously hospitalized. So this could be either you could activate them, or the office would be the person to activate them. Either way, if the office activates them, you'll get an email saying that they've been moved, and then also you'll find them in here on your new patient list as well. So after that, non-admit, or you would evaluate, and the evaluate and non-admits were covered in other videos. So if you need a brush up on those, you can find those in the other videos. All right, well, that's it for this video. If you guys have any questions, you can reach out to the office, and we'll help you out as best we can. All right, thanks.